Hi everybody, I'm Dr. Jeff Davenport, the DPC guru. I've got a few notes here, I hope you'll forgive me. I want to talk to you a little bit about dementia. So here I've got notes to help me remember. So dementia is a very common problem. It's certainly more common as we age. I tell all my patients that starting even at age 40, we all begin to have some cognitive decline. So I'm 48. I tell people I am less intelligent now than I was 8 years ago. So starting at age 40, we all have some decline in brain function. But dementia is a significant decline that affects daily living activities. It's only about 5% of people in their 60s, but that's still 1 in 20, so a very common problem. It also increases to up over 35% of people in their 90s. So it roughly doubles in likelihood every decade past the age of 60. Alzheimer's dementia is by far the most common. There are other versions. You can have vascular dementia, Lewy body dementia, Parkinson's, frontotemporal. There's a lot of different potential causes of dementia. And you can also have multiple causes. It could be a mixed cause dementia. But Alzheimer's specifically ranges from 60 to 80% of all dementia. So that's the one I'll talk about mostly. Some of your risk factors for dementia would be natural aging, as we've discussed, family history. The one that's the most important to me is the cardiovascular disease, diabetes, and obesity. If you are overweight or unhealthy in your middle years, you drastically increase your risk of dementia in your older years. And so this is why blood pressure and blood sugar and all of the things that us doctors just rant on all the time, it's so important to have those vascular illnesses treated appropriately, because you drastically increase your risk if you ignore those problems. So try to stay healthy and take your medications and treat your vascular problems like diabetes, blood pressure, etc. And that'll decrease your risk for dementia. Interestingly, there has been an actual decline in the prevalence of dementia since the year 2000, which they're suggesting roughly correlates in improvement in treatment of all of these vascular problems, whether diabetes or blood pressure or cholesterol or whatever. You might notice statins get a really bad rap sometimes. Some people believe they actually increase the risk for dementia, but this is not true. Statin drugs actually help prevent dementia because of exactly what we're talking about, having healthier blood vessels. So for those of you who are out there anti-statin people, I disagree with you. I think they are pretty good drugs. Let's talk a little bit about what if you're worried that you might have dementia or that a family member might have it. How do you screen for it? How do you diagnose it? The reality is most of us physicians, and even you, could go online, and there's a couple of very, very simple screening tools that take just a few minutes. There's one called the Mini-Cog, COG, so that's short for cognition, which is the doctor fancy term for how well your brain works. The Mini-Cog. There's another one called the General Practitioner Assessment of Cognition. I think they call that the GP-Cog for a short name. These are super, super easy screening tools. Matter of fact, I could tell you exactly what they do. The Mini-Cog is just, you have to remember 3 things, like, for example, apple, table, penny. And then the person repeats it back to you. Then you have them draw a clock face, putting the numbers in the right position. And then they have to draw hands that show 10 minutes after 11. And then the third thing is to go back to the 3 things that they were supposed to remember and see if they remember them. Do you remember the 3 things that I just said? Apple, table, penny. So that is how short the Mini-Cog screening tool is. It's literally just 3 things. We just did it in 60 seconds probably. So if they struggle with any of those 3 things, can they say the 3 things back to you? Can they draw a clock face and put hands on it that show 10 minutes after 11? And then can they recall the same 3 things that you had said previously after doing the clock face? And that's how quick it is. So if they do really well, then that's a really good screening tool, and you don't have to worry about active dementia at that time. If they struggle with those three things, then get them to a doctor. And there are further assessments. There are more extensive questionnaires, the mini mental status exam. There's a Montreal screening tool. And then for us physicians, we've got to do some blood work to check, make sure we don't have any other diagnoses that are causing the problem, like anemia or B12 deficiency, etc. There are some imaging studies, like an MRI of the brain, to basically rule out other medical causes of dementia that are treatable. Certainly there are some tests that you could do to try to actually make that diagnosis. But all of that should be done by a physician. But a real quick mini COG assessment on your own at home with your family member, if they're willing to participate, that's a great way to kind of start the process if you're worried that there might be some early dementia or some dementia at any age beginning. So I'm Dr. Jeff Davenport, the DPC guru. Now you know a few things about Alzheimer's dementia.